helping people cope with and overcome life's challenges. This is Life Transformations with Michael Hart, Canadian certified counselor and award-winning psychotherapist.
Welcome to the Life Transformation Show, where we provide insights that lead to healing and hope. In today's show, we'll be exploring the topic, mysterious illnesses. So, have you visited multiple doctors, but no one can tell you what's causing your persistent pain, fatigue, or discomfort? Or do you feel trapped in a cycle of treatments and medications that provide no relief? Is this mysterious illness slowly starting to affect your work, relationships, and emotional well-being? If this sounds familiar, stay with us. Because today, we are discussing these unexplained health conditions and offering insight into what might be behind them. We'll also explore how you can find hope even when medical answers seem elusive. The Bible reminds us in Jeremiah 30, verse 17, "For I will restore health to you, and your wounds I will heal, declares the Lord." Let us hold on to the truth that God is the ultimate healer. He sees our suffering, and His promise to restore health offers us hope, even when human wisdom falls short. We will also be providing information about a type of psychological treatment that has proven effective in treating these mysterious illnesses. So whether you are facing these struggles yourself, or you know someone who is, stay tuned as we unravel the mysteries behind these conditions and discover how faith, prayer, and practical solutions can lead to healing and restoration. In studio with me is renowned psychotherapist Michael Hart. Welcome, Michael.
Thank you, Denise. I'm really looking forward to diving into this topic today, because it is something that I see affecting many people who come into my office. Mysterious illnesses, or somatic symptom disorder, as we call it in the clinical world, is incredibly frustrating for those who are suffering from it. They can't seem to find answers, but they're experiencing very real physical symptoms that don't seem to have a clear medical explanation. And this often leaves them feeling as if they have hit a dead end in their search for relief. So I like that verse that you referred to in the introduction, because today we're going to be talking about this incredibly difficult disorder in a way that gives hope and also brings some answers that people might have been searching for a long time.
Thank you for naming this, Michael. You refer to it as somatic symptom disorder. And there must be a way to identify this disorder. So what are the signs that someone may have this?
Well, I won't go into the clinical literature to look at the symptoms that are necessary for you to be diagnosed with the condition, but I can give some conditions, some signs that if you are having these signs, it's possible that you're suffering from this disorder. And this is not a diagnosis, as I have said before, but just some of the common things that I find in my clients who are suffering from the disorder. Many of them have a history of going to many doctors or just shopping around to get a diagnosis. They're looking to be diagnosed with some condition. As I said before, the symptoms that they're experiencing are real, and they can't seem to get a clear diagnosis. The doctors are not clear as to what is the condition that they're suffering for. And many of these clients who have gone to doctors, the doctors have tried to calm their fears and to relieve the anxiety that they have by telling them that nothing is wrong, but still they continue to suffer. You may also find with many of these clients that they are suffering from social anxiety. The condition may have rendered them as such that they are now afraid to socialize as before, or they may be afraid to engage in physical activity because of a fear of making their conditions worse. Some of the common symptoms include pain, weaknesses, and just a general feeling of fatigue. And so the pain persists despite treatment. They have this general feeling of weakness and fatigue. And in addition, we find that many who are suffering from the disorder, that their symptoms do not respond to medical treatment. In other words, the doctors may have tried a number of different medical solutions, but nothing seemed to relieve the condition that they have. So you can imagine that these clients are very frustrating. They are seeking help, but they can't seem to get help. They are seeking relief, but they can't seem to get any relief. They are seeking answers, but they can't get any answer.
That's a lot of symptoms, Michael. I can imagine that listeners are now on the edge of their seat because they can identify with some of these signs. Now, we are waiting to find out, what are the causes of somatic symptom disorder?
That's a good question, and I'll look into that. But just before I go into this, let me say that it's possible that you may have some of what I have referred to here, and yet you do not have the disorder. It's possible to have some of these symptoms where you have an illness, you can't get answers, but it may not meet the threshold to be diagnosed as a disorder. But nevertheless, you are suffering. And I think whether or not you can be clinically diagnosed with this disorder, you can still benefit from what we are going to cover in this show today. So what are the causes, I think was your question, Denise. So some of the causes of this disorder include a history of abuse, experiencing physical, emotional, or sexual abuse during childhood can have a lasting impact on how someone's body and mind process physical sensation later on in life. The trauma that they endured at a young age can alter the way that they perceive and respond to what's going on in their body. So sensations may be heightened. What may not be received as a signal of pain for others may be perceived as such by someone who have suffered trauma as a child, who have been abused in any way. So the nervous system is somehow misfiring and they're feeling pain symptoms. I said before, the pain and the fatigue is real, but often there is not a physical reason behind the pain. A lot of times there are psychological issues such as sexual abuse. Another possible cause of the disease could be a history of a serious childhood illness. When someone experiences a serious illness during their childhood, it can profoundly shape how they perceive and react to physical symptoms of pain. So their system may have been programmed to react in an intense way because of the suffering that they endured as a child. And so in adult life, their nervous system is perceiving signals of pain as being very intense. And so the doctors cannot find anything physically wrong because the symptoms that would normally relate to that level of pain cannot be diagnosed. But nevertheless, the pain is real and the suffering is real. What we also know from the psychological literature that when someone has prolonged stress, if you grew up in a hostile environment where you are always in fight or flight, it can throw off the hormones level in your body. And so you can have high levels of cortisol, the stress hormone. And over time, cortisol can lead to having high levels of cortisol can lead to inflammation in a person's body. So this inflammation is perceived as pain, and people experience pain all over, but there is no known cause. There is no physical cause for the pain, but the pain is nevertheless real. So those are some of the possible reasons for the disease. But however, let me say that these are just the ways that psychologists tries to explain what could be behind the disease. But there could be many other reasons, some of which we may not know at this point.
So, Michael, from what you mentioned about the causes, I can see why doctors would have a hard time diagnosing that what this disorder is actually is, or if a person has this disorder. So how severe would the impact be on individuals?
That's a very important question, a very important topic for us to look at, because a lot of times we underestimate the level of suffering that someone with this disease, this disorder goes through. So it's not just a physical ailment. There is psychological suffering that happens as well. Can you imagine the frustration of someone whose doctor acts as if they're a bother, like maybe the doctor roll his or her eye every time this person goes in, as if to say, here you are again. I tell you that there is nothing wrong. We can't find anything wrong with you. So this person begins to feel low self-esteem, begins to develop low self-worth, begins to feel as if they're a bother to others. And so, because the illness is not something that can be seen with the eye, like a broken leg or a broken arm, a lot of time these people are not taken as serious. Their condition is not considered serious, I could say, but they're suffering. And as a result, they sometimes start isolating themselves from others, sometimes because of the psychological impact of the disease. They live in fear of the conditions being worsened. And so they withdraw from social interaction. They withdraw from physical activities even. And that withdrawing from physical activities lead to their conditions worsening. And so as they withdraw, they develop other conditions as well. And there's also financial cost, because many individuals with these conditions, they're trying a lot of remedy that are not covered by the health care system. And so they're spending out of their pocket to try to find remedies. And they're going to many naturopath and other health professionals trying to find an answer to their condition, but nevertheless, they continue to suffer. So there's a financial cost as well. There's a relationship cost, as I have said before. There's a social cost as well. And there's an effect on the person's mental health because of how they're treated. So to answer your question, the impact is very severe on individuals with this disorder.
So you touched on many impacts, the physical, the social, the financial, and psychological. So can you go further into helping us understand how this affects one's mental health if they're suffering from this?
Yes. And so with the mental health, levels of anxiety are usually very high for someone with this disease. Can you imagine you have a condition and no one can give you the answer as to what this condition is? So there is this fear that this condition could be getting worse. So many people with this disease, with this disorder, has very high level of anxiety because they live in fear of the condition getting worse. They also live in a constant fear of discomfort because they're suffering and no one can tell them exactly what it is. So they may develop depression and hopelessness about the future when they have somatic symptom disorder because they're not getting the answers that they need. So anxiety, depression, a chronic level of stress will develop as a result of this. So many people with this disorder develop these mental health issues as well.
Very interesting response to that, Michael. So you've said before that this disorder do not respond to medical care because medical doctors cannot find anything physically wrong with the person. So does psychotherapy help people who are suffering from these illnesses?
Yes, psychotherapy, and particular branch of psychotherapy that's called cognitive behavior therapy, is very helpful in treating this condition. There are a number of studies that have been done that shows the effectiveness of cognitive behavior therapy, or CBT as it is called. In one of the studies, participants who did 6 to 16 sessions of CBT showed significantly greater improvement than patients who received just medical care. In another study that examined the medical records before and after the study, they found that there were substantially more participants who received CBT who rated their improvement as, quote, very much improved, or, quote, much improved. So this to me, it's very important. These are individuals who are suffering for years, cannot find answers, have been looking to the medical system, and some feeling ridiculed and shunned. And through CBT, they're saying in this study that their conditions were very much improved, or much improved. But what is also very interesting in the study is that the improvements that they had persisted over time. So they went back to the participants in the study 3 months after CBT ended. And what they found is that at the 3 months interval, they were still showing improvement. And at the 9 months interval, they went back to check on the individuals, and they're still reporting at the same level of improvement that they had. And at the 15 months mark after the study, when the study ended, these individuals who had CBT were still showing improvement in their condition.
Well, we did say, Michael, that we were going to provide insights that lead to healing and hope. So this is hope, Michael, that CBT can provide such improvement for anyone who is suffering from this disorder. So can you expand now on how CBT can help?
Well, CBT helps in a number of ways. Let me say that in general, counseling is effective. Counseling in general can help in that it can deal with the underlying root issues. We talked about abuse of many kinds that could be at the root of this disorder, somatic symptom disorder. And so if you have unresolved trauma from your childhood, or you're reacting out of fear to symptoms because you suffered from a sickness, from a severe illness as a child.
Michael will be right back. You have been listening to the Life Transformation Show, where award-winning psychotherapist Michael Hart of Elim Counseling Services has been speaking on the topic, Mysterious Illnesses. You can find out more about us at elimcounselingministry.com or by calling 1-877-204-2914, where you can also make a donation to this Christ-centered ministry. Your donations help us to stay on the air and to provide subsidized counseling to those who can't afford it. Back to Michael.
Doing therapy can help you to overcome those emotional wounds from your past. But CBT in particular help by changing dysfunctional thought patterns that exacerbate the physical symptoms. So if you're stressed or anxious because you're thinking your condition will worsen and you're predicting negative outcome, then you are more likely to manifest those physical outcomes. So by changing negative thought patterns, CBT can help to start healing rolling in the right direction by changing those negative thoughts. So secondly, CBT helped by changing behaviors. Many people with somatic symptom disorder or mysterious illnesses, they live in fear of these diseases. So it's like Mephibosheth in the book of Samuel, where he had this injury from his childhood, and he was living in this desert place in fear that King David was going to kill him. But as the story unfolds in the book of Samuel, we see that King David was actually trying to help Mephibosheth and sent for him to live in the king's palace. So people who live in fear is like Mephibosheth. They're withdrawing from others. They're living in fear. They're afraid of being shunned by friends who may think that they're always talking about their physical condition. And so by changing behavior, CBT can help them with reintegrating with their social group in a way that is healthy. CBT may be able to help them to have conversations that may help people to rally around them instead of shunning them. And CBT can also help by introducing relaxation training that can help them to relax. And as the body relaxes, the pain symptoms begin to dissipate as well. Because if you're feeling pain and you're tense and anxious and worried, you can lead to a worsening of your condition. You don't give your body a chance to heal. So by relaxing and learning relaxation technique, you're setting up your body in a way that can help. So these are some of the ways in which CBT can help. There are many more ways, but these are some of the ways in a nutshell.
Thank you, Michael. And listeners, you can get your CBT therapy at Elim Counselling Services. So we all know that we are made of many parts. Right, Michael? Yes. Physical, spiritual, and emotional. So help our listeners understand how spirituality can help with the treatment of somatic symptom disorder.
That's such a good way to transition this show, then, is because the spiritual is extremely important. Those suffering somatic symptom disorder, many of them have lost hope. So spirituality can play a profound role in helping people to begin to have a sense of hope again, and can lead them to a pathway of healing that extends beyond just the physical symptoms. So when you are trusting in God for your healing, you're not disappointed when the doctors say that there is nothing wrong with you and there is nothing they can do for you. You know that your hope is in God. One powerful example from the Bible is the story of the woman with the issue of blood found in Mark 5:25 to 34. Her journey reflects the struggles that many people with somatic symptom disorder face today. The Bible told us that she had been to many physicians and she could not find healing, that she had suffered for 12 years, spending all her money on doctors, yet no one could heal her. But we see in that story, in that incident, that narrative in the Bible, that when she turned to Jesus, she found healing and acceptance. So faith in healing beyond physical means is what spirituality offers. And spiritual healing can also be found for emotional and mental distress. The woman's physical ailment was deeply connected to her emotional and social distress. She was considered ceremonially unclean, which likely led to isolation and shame. Similarly, people with somatic symptom disorder often experience emotional pain, frustration, anxiety, or feelings of hopelessness because they cannot find an explanation for their symptom. So we see that when Jesus healed her, it was just not physical. She reintegrated with her society. So you too who are suffering from somatic symptom disorder, you too can find that reintegration by accessing the healing that's in your faith. And so your faith can give you the sense of peace that transcends understanding even while you are suffering. Philippians 4:6-7 says, "Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your request to God. And the peace of God, which transcends all understanding, will guard your hearts and your mind in Christ Jesus." This peace can alleviate the mental burden that often accompanies unexplained illnesses. But I'd also like to say that the community of faith is very important. Your faith and having a community of believers that you socialize with can help to offset the distress and the aloneness that you feel because you're isolated from others. So reintegrate with your social group. And if you need help to do that, I think seeing a trusted therapist who understand the spiritual side of life, a Christian therapist like myself, who is also knowledgeable about the Christian community and the Christian faith, can be a potent tool to help you heal if you're suffering from mysterious illnesses. So being a part of a faith community provides support, encouragement, and prayers that can help you heal. Indeed, James 5:14-15 says, "If anyone among you is sick, let them call the elders of the church to pray over them." And so this is what you can have when you're part of a faith group.
So we're at the end of our show. Thank you, Michael, for helping us understand this disorder. Thank you for joining us today as we explore the topic mysterious illnesses. Tune in next Monday at 9:30 when we will be looking at navigating grief and loss, finding comfort in the darkest moments. A show that will help many who are mourning to go through their grief in a healthy way